I promised that I would be discussing few conditions, particularly so that people here are benefited. And once you know the root cause of diseases, I'm sure you would be able to find better answers. To start with, the most common thing today is when people are troubled with cysts, fibroid, and tumors. What I have found is that the basic reason for all these conditions which I've named are the infections, and the infections need acidic environment to grow. So if you are able to bring down the acidic level, so definitely this will contribute in these conditions to contribute to help in this condition. I'm sorry. So this again links back to the kind of water we drink, because now Kangen water, as you know, is alkaline. It has a reach inside the cell because it is microclustered. It is very thin water, so your cells can actually absorb more water and flush themselves out, so that they could bring down the acidic level. And I've just told that what acidity contributes in these conditions. So next is blood pressure. When you talk about blood pressure, first of all, let me tell you, the numbers doesn't count here, because blood pressure depends on lot of factors. It depends on the activities, your daily activities, your lifestyle. But the first and foremost thing is the water you drink. Because if you're drinking less water, the blood becomes thick and it directly affects your blood pressure. So it is essential for you to drink right kind of water in the right amount, so that the viscosity of the blood is maintained. And again, our Kangen water contributes a lot when you talk about the viscosity of the blood, because I'm sure you can find a lot of videos where people have done live blood analysis. It's also called dark field analysis, where people have shown that within 10 minutes of drinking Kangen water, it can actually show under the microscope the difference between before drinking the Kangen water and after drinking Kangen water. So this is about blood pressure. And next is the heart conditions, very important, because this is one of the biggest pandemic humanity is suffering from. According to my experience, what I have in my practice, what I've seen, whenever a person comes to me with a heart condition or any heart issues, I found that there has been a chronic, very long associated urinary infection. These urinary infections can be in the urine bladder, in prostate, in urethra, or even the kidneys. So what happens is, when there is an infection in urinary tract, it actually and when it becomes chronic, it actually starts to block the passage of urine, and this blockage of passage creates a back pressure, which is directly affecting the function of the heart. And so whenever the patient comes to me for any heart issue, so what I do is I focus on the urinary tract system, and most of the time, the patient is treated successfully by simply taking care of the urine issues. So, and same thing happens to the prostate issues as well. So I have found similar infections when it comes to the prostate. And the next condition I want to talk about is migraine. This condition it raises a lot of eyebrows. It affects almost more than 60% of the world population today. And there are certain factors like stress, acidity, which contributes, but no one knows why this happens. What I have found is that due to certain things, due to certain factors, the vessels of the brain, they shrink. And when they shrink, the pressure of the blood, that's the blood pressure, actually your heart, when it tries to pump the blood into the brain with the shrink veins, it creates a pain. And I have tried to ask this question to many doctors, but they know that this happens, but they don't know why it happens. What I have is it happens mainly due to a hyperacidic level inside our body. And when the acidity increases, this condition occurs again and again. And I myself used to suffer from migraine very badly. There was once time. Then if you are able to drink enough water and alkalize the acidic environment, this is one of the first condition to disappear. And I'm sure you guys have heard a lot of good words about drinking a particular kind of water, and the migraine disappears. All right, so this is about migraine. Next condition I would like to talk about is arthritis. This condition is caused by infections and hyperacidic cells. You see, whatever I have discussed so far, you must have observed there's a link between the acidic level of the cell or your body and the infections, load of infections. So as I've said, that infections need acidic environment to grow. And if you are able to bring down this acidic level, you not only bring down the chances of overload of infections, but also what you do is you bring down the rate of oxidation, which is the actual cause of the cell disintegration, of destruction of cells. So I hope one very important condition, which is RCT, which is root canal. It is quite controversial. So I wanted to miss it, but somehow I think I should cover this as well. I'll tell you what I've found in my practice. When a patient comes to me, especially for cancer, especially when you talk about breast cancer, the first question I ask to the patient is, do you have a root canal? And 98% of the times, every breast cancer patient, unfortunately, had root canal. And what I found is, if the root canal is on the left side of the jaw, the first tumor which comes in the breast is on the left side. So, and if it is on the right side, the root canal is on the right side, the first appearance or the occurrence of the tumor is on the right breast. It is not only connected to breast cancer, but it is definitely connected to most of the chronic conditions. Why is it is? It is because our every tooth is connected to a pathway which is called meridian. This meridian is the pathway of this negative charge which I've been talking about for so long. So that negative charge goes through this meridian, and this particular meridian, which is connected to a particular tooth, is traveling all through your body and connecting to particular organs. So it is seen that if on a particular tooth there is the root canal which is done, it affects that negative charge to travel, it blocks rather, to travel to those organs. And all those organs which are connected to that particular meridian gets affected. So what I have found is that when I tell my patients to take care of the root canal, by taking care, it means taking out that root canal. And once they do that, within 72 hours, 80% of the symptoms, the sufferings of those chronic conditions which the patient comes to me for, just disappear. And I don't want you to believe what I'm saying, but there are certain books, there are certain coverage where this issue has been discussed in depth. There are so many experts. One of the experts is Dr. Jerry Tennant. He talks about it a lot in his book, Healing is Voltage. And so this root canal issue is really, really serious. You should, in fact, look into it and research about it. And thank you, Michael, for giving me a little more time on this.
Thank you very much too, Dr. Vivek. Thank you for bringing up the importance of cellular health. This is basically what we are talking about in Kangen too. And also thank you for bringing in the relevance of this ORP meter demo that we do when we go and show people about the usefulness or the importance of how the benefit Kangen water. By the way, ORP means oxidative reduction potential. Doctor just mentioned, the ORP of orange is -50. At -80, cancer cells die. And we are also showing it, how Kangen water has an ORP of between -400 to even -700 sometimes. Thank you, doctor. Thank you very much. But I'd like to come back to this particular question, because when I talk about you, a lot of people say, hey, how come an oncologist like you is interested in doing Kangen water? Besides what you just explained, can you tell us in very simple terms, what attracted you to Kangen water?
See, when I was treating cancer patients, I was always, in the search of things which could actually help my patients. And once once I came to know about the significance of negative charge in treating cancer and chronic conditions. So the first thing is the ORP, the negative ORP, or the negative charge in this water, which actually attracted me. And there are many ways to supplement this negative charge, but how simple is it that you are supplementing negative charge, the most important thing what your body needs, just by drinking water. And this is one of the things which got me into Kangen.
Here you are very involved now with the Kangen business because of the benefits that you have shared now to a lot of your friends and relatives. How long did it take you to become a 6A doctor?
Well, I'm a very lazy person, and it took me nearly 2 years because I've had a very busy, hectic schedule because of my practice. But it took me nearly 2 years to become 6A, and but in these 2 years, I have found quite a lot of wisdoms. You know, in fact, I would like to give this wisdom to people here. I found the basic requirement for being able to do this business successfully is simple communication. If you know how to speak to people, if you love to speak to people, just communicate to people, that's the only requirement you need for this business. You know, I just remember one instance I would like to quote here. I met a person very recently, maybe last month, and I was talking about Kangen to him. He said, "I don't like people. I don't like to talk to people." I was thinking in my mind, is he a normal person? Because if a prospect tells you that he doesn't like to talk to people, he's born into people, he's living in amongst the people, and if someone says this to you, he has to go to the doctor to consult because he's not normal. You cannot survive without talking to people. And if you don't like, then the person need medication. I think you need to take care of himself. And Kangen is one thing which only needs you to communicate the truth. And if you really don't like to talk, what you can do simply is to share the water and let the water do the talking for you. Because there have been so many testimonies and my experience as well. I've been sharing a lot of water, and by just simply sharing the water, people just get along with you, and they buy this machine because they find out that this water is just amazingly magical.
Wow, that's good advice, doctor. Share the water. Sometimes no need to talk that much because our product talks for itself. Thank you.
Absolutely.
It's remarkable, to know that a gentleman like you, professional like you, got to like our Kangen water. Let me go back to something which a lot of people are interested in finding out, How did this Kangen water help you to make you decide, come in and spend more time in building up this business?
Well, I came to know about this water a long time back. My mentor, Webster Care, he's from America, and he is into natural treatments for cancer more than about 35 years now. So he suggested me that he told me that he suggests patients Kangen water. So because he said he suggests, so I did not understand what Kangen water is, but I started telling people about there's a water which is called Kangen. And I didn't know anything about it, but simply because my mentor used to say that I started. But in 2018, when my elder brother, Dr. Bhatnagar, came to me, and he actually suggested me that I should go through this information. That was the first time I came to know about the goodness, about the reasons why this Kangen water is magical. And since then, it has become a rule. If the person want me to treat, he need to change his water. Because you see, as I said in my presentation, if you do not focus on the 75% of your body, which is water, you cannot get long-lasting results.
Yeah, you make a lot of sense there, Doctor there. Look after the 75%. 1% change is a lot. Look after 25%, 1% change doesn't make that much difference. Thank you for sharing. Sam, if you're around, Sam, would you have any questions to ask Doctor while he's around?
Yes, I do actually. Thank you, Doctor, for coming to share your insights.
Pleasure.
Right, and let me see. I'm trying to get myself into the. Yep, I'm okay. I'm on now. All right, good. Can I just take it, but sort of recall. I'd like you to expand a bit on, or rather to repeat on what you've just said. Did you say that 98% of people with root canal has, or rather, I think you said that 98% of people with
who came to me?
Okay, let's hear from you. Something, yeah. I just want.
I knew, Sam, this question is going to come.
Okay.
All right. Let me repeat. Okay. So I specialize in oncology, and I get a lot of cancer patients, okay. And when I get breast cancer patients, this is the first thing I ask them: how many root canals you have, or do you have root canals or not? And 98% of the time, these breast cancer patients have root canals. And the first thing we do is to take out those that root canal procedure. And yes, I said within 72 hours of taking out the root canal tooth, up to 80% of the symptoms just vanish. And this is just amazing. It's just like magic. People are, they couldn't believe that it was happening just because of this tooth.
Can I say something on root canal?
Yeah, please.
I've had 3 root canals done in my mouth in the last 1 year.
I'm sorry to hear that.
And I know I heard from Bernard Chan, I heard from you, and you asked me to get it out of, to remove it.
There's no other option. There's no other option.
I know. I did speak with a very senior doctor who's 61 this year, and he's an anesthetist. And this guy is a functional doctor. I went to speak to him just about 2 weeks ago, just to ask him this question. I got 2 friends who speak to me to ask me to remove my root canal. I want to hear your view. You know what the doctor said? I'm sorry to say that your 2 friends are correct.
Yeah.
So I'm now in the process of looking for the right dentist to remove that. And I would like to also just add, okay, he also said to me, not only just root canals, amalgam fillings with mercury, all right? Remove those amalgam fillings with which has mercury.
Anything which has silver color in your teeth, which has been put by any doctor, you should take it out because it has mercury.
I've got 6 of them. I've had 6 of them in my mouth for a lifetime already. Yeah. So that's another thing that I've got to remove. One second. Let me just handle something here.
Yes, Bernard, I get your point. You cannot go to any dentist to take out this root canal. You need to find a biological dentist There are very less in the world. In fact, when I talk about India, I could find only one dentist who is fortunately in Delhi. So you cannot go to any dentist and say that, tell the hello, can you hear me?
Yes, I can go on.
Yes, you loud and clear, doctor.
All right. So you need to find a biological dentist to do the job, because they are the only people who are trained professionally to take care of this issue. Otherwise, it'll be again worse than the problem you're facing right now.